Welcome back to another video, guys. My name is Cbudenz. I'm your independent health insurance agent. Today we're going to talk about the alphabet soup of Medicare, the A, B, C, and D of Medicare. And before I start, I want just to let you guys know that I'm not going to be putting any, graphs or charts or numbers in here because I think it kind of confuses it and makes it a little bit more harder than it needs to be. So hopefully this is very simple for you guys. I'm going to try and keep it very brief and sweet. So first off, when we talk about the alphabet soup of Medicare, it's going to be comprised of A, B, C, and D. And we're going to jump this video off with talking about A and B first. And part A is the first, and that's going to be hospital coverage, right? That's going to be your hospital stay, your ambulance, your hospice, your, everything related to hospital, and that's going to be made up of, that's part A of original Medicare. And for most people, there's not going to be any costs to part A. And so in most situations, you're not going to have to worry about paying a premium for part A. So that's part A, that's part of original Medicare. And then the other part of original Medicare is part B, which is medical. And this is going to be, your doctor visits, your specialists, your labs and diagnostic tests, your durable medical equipment, things of that nature will fall under Part B. In Part B, unfortunately, there is a premium associated to Part B. And in 2025, that is $185 a month. Now, that can be a little bit higher depending on your financial situation. But for most people, it's about $185 a month. And Part A and Part B together make original Medicare. And so one important thing with Part B is you do have a deductible for Part B. And in 2025, that is $257 a month. And so once that deductible has been met, you have 80/20 coinsurance. Where Part A and Part B, original Medicare, are going to cover 80%, and you're responsible for 20%, and that's unlimited. There's no cap on that 20%, which can be scary. And we'll talk maybe later in this video a touch and some other videos I'll make about how you plug, that unwanted 20% uncapped amount. But Part A and Part B make up original Medicare, and a big question is, when do you take Part A and Part B, and sort of the timeline for that? And Part A and Part B, for most people, you're going to want to take that right at 65. Now, if you're going to continue to work past 65, then you may elect to keep insurance through your employer. And sometimes you can do that, other times you can't. And that deciding factor is if you're working for an employer and that employer, the company you work for, has 20 or more lives, then you can keep insurance through work and you would delay Part A and Part B. If it is less than 20 lives, then you're going to want to take Medicare right at 65 to avoid any penalties. Now, as far as the timeline to sign up for Part A and Part B, you're able to do that 3 months prior to the month you turn 65, the month that you turn 65, and 3 months after you turn 65. So you do get a 7-month window of what we call your initial enrollment period. And your Part A and Part B is going to start typically on the first month, or the first of the month that you turn 65. So if you turn 65 November 15th, in most cases, Part A and Part B will start on November 1st. And so together, once again, Part A and Part B come together to give you original Medicare. And so now we're going to move to Part C, which most people have heard of this, maybe not talked about as Part C, but that is Medicare Advantage. And Medicare Advantage is going to be insurance through an insurance company, a private insurance company. And you don't have to, this is not something you have to do. This is just an option and known as Part C. So this is not anything that you have to do. This is something that you can take or not. With Medicare Advantage, like I said, you're going to have insurance through a private insurance company where you're going to have co-pays and co-insurance and things like that, more of like a insurance you've probably had through work, where you're going to have copays and things like that to use it throughout the year. Most of the Medicare Advantage plans typically are about $0 a month, and they will have networks. So a network of doctors and hospitals that you're going to have to stay within. And that's made up right of Part C, Medicare Advantage. A lot of, good thing about Medicare Advantage is they do have everything kind of wrapped into one. They have dental, vision, and hearing typically included in their plan, as well as Part D, which is your prescriptions, which is a good way to transition into the last alphabet soup, if you will, Part D. And Part D is your prescription drugs. So think of Part D as, the plan that you would use to go to the pharmacy and pick up your medications. That is what Part D is involved in. And so there's two ways that you can get a prescription drug plan, or Part D. You can either get a standalone prescription drug plan, and typically that's the route you would go if you purchased a Medicare supplement, or like we just talked about, Part C, Medicare Advantage, has Part D or prescription drug coverage already built into it, so there's not another plan additionally that you need to have. Now, the premiums for your prescription drug plan can vary from state to state, and primarily is going to be based upon the medications that you're taking. And so there are certain plans that may cover certain medications better, or certain medications that are not covered on a formulary that are on another plan's formulary. So it all depends on the medications that you're taking. Now, it's important to note for you that even if you're not on any medications, you need to have a Part D plan. If you don't, you will have lifelong penalties, and it can add up pretty quick. So even if you're not on a lot of medications, or maybe none at all, you still want to have a prescription drug plan. And obviously, if you are on a bunch of different medications, it's very important that you have a prescription drug plan. And so when we look at the alphabet soup in general, I'll recap for you guys. We have Part A, hospital; Part B, medical; Part C, Medicare Advantage; Part D, prescription drugs. And if this seems a little overwhelming, hopefully this video helped. But don't feel alone if you still think this is a lot of information, because it really is pretty simple. And so if you're in this period where you're going to be turning 65 soon, or maybe you worked past 65 and have not taken Medicare, and you want someone to walk you through this, make this whole transition a whole lot easier, please reach out to me. I have my phone number and my email listed in my bio for you guys to look at. It's free to talk to me. There's no obligation. All my services are 100% free to you. And so please take advantage of someone like myself, or any other agent perhaps that you know, because it's super important to get this information right and make sure that you're making the right decision and getting everything done in a timeline that you need to avoid any penalties or lapse of coverage. So hopefully this video helped. Please like, share, comment down below with someone that you know needs to hear this, or you have questions for me, please drop that down in the comment section below. I really appreciate it, guys, and I hope you have a good week.